I'm Julia Oye.
Hi, I'm Courtney Infante.
This is Jason.
I'm Michaela Mabry.
And I'm Alfonso Macias. And our Becoming Influential project is on wellness, self-care, and nursing fatigue.
It is believed to be the duty of the nurse to provide self-care and wellness to themselves to prevent adverse events and nurse burnout. Nurses who are tired, stressed, and unable to focus are at highest risk for nurse burnout, which can ultimately lead to the individual leaving the profession. The American Nurses Association includes self-care as Provision 5 of the Code to ensure that nurses not only take care of their patients, but to make sure that nurses are taking care of themselves. When a nurse is healthy, physically, emotionally, mentally, and in every way, they are able to promote health and safety within others.
Wellness and self-care and nursing fatigues are all very relevant topics when it concerns nursing. The environment that nurses work in is very high demanding, not only physically, whether it be like lifting patients or, helping them walk, but it's also very mentally exhausting. It takes an emotional toll on a nurse, and this can lead to nursing fatigue and burnout. And the book defines burnout as a prolonged emotional and physical exhaustion that causes a diminished interest in nursing because of the high workload without relief. So it's important that nurses really make sure to take care of themselves to help combat this from happening. This can lead a nurse to pursue a different career, so that leads to high turnovers, and that's a major problem that the U.S. healthcare system is experiencing. It's projected that in 2025, the nursing shortage will reach 260,000 to 400,000. And it's not only important for the nurse to do her part in taking care of herself, but it's also important that the employers and legislation do their part to help take care of our nurses that we have to ensure that we don't extend this nursing shortage that we have at the moment.
A personal story that I can relate to wellness and self-care nursing fatigue is one time during my OB clinical rotation last semester, I followed a nurse that was experiencing an overload of responsibilities that was difficult to manage by one person. That day, she was a charge nurse of the NICU, also caring for the two most critical patients on the floor. During the clinical, one of the two critical patients required constant nursing care and at one point needed to be ventilated by an ambu bag because of constant O2 desaturations. According to the HR 2581, Nurse Staffing Standards for Hospital Patient Safety and Quality Care Act of 2019, nurse administrators and supervisors are not to be included in the calculation of direct care registered nurse to patient ratio. This bill would support that in my nurse's case, she would have not been required to take on two critical patients on top of being a charge nurse. This would have further reduced the high levels of stress she was experiencing that day, and she would have got to allocate all of her attention to being an efficient, undistracted charge nurse.
The position of HR 2581 is to reduce the number of patients that a nurse can be assigned during a normal working shift. This is good because more nurses is always a good thing. More nurses taking care of less patients is an even better thing. The only stipulation is that in times of an emergency, obviously everything is going to be changed.
So the bill is looking to improve the current Public Health Service Act by changing the established direct care registered nurse to patient staffing ratio requirements. Now, it argues that the federal government's interest is to promote quality care and improve the delivery of healthcare services to patients in facilities here in the U.S. The changes in the health system that resulted in patients that need more attention and need an improvement in quality to protect patients and reduce the incidence of medical errors. These problems they arise from poorly monitored nurse staffing practices that place patients in jeopardy. There's studies that show that the patient care outcomes are directly correlated to direct care registered nurse staffing levels. Requirements for direct care registered nurse staffing ratios help address the nurse shortage in the United States by aiding the recruitment of new registered nurses and retaining those leaving because of the demands created by inadequate staffing. How is HR 2581 going to help? What this bill asks for is the hospital to implement a staffing plan that provides appropriate delivery of services and protects patient safety. It also asks for minimum direct care registered nurse to patient ratios. Not including exceptions detailed in the bill like disasters, a nurse would be assigned to not more than the following number of patients in the unit as detailed. So they would have one patient in trauma emergency units and OR units if in the OR unit the nurse is provided minimally one scrub assistant. They would have two patients in critical care units like NICU and ICU, labor delivery, PACU, and burn units. They would have three patients in emergency room units, pediatrics, step-down units, telemetry units, antepartum and postpartum units. They would have four patients in medical surgical units, acute care, psychiatric units, or specialty units. They would have 5 patients in rehab units or in skilled nursing units and 6 patients in postpartum units. In making the staffing plan, a hospital will provide for direct care registered nurse to patient ratios above the minimum ratios required in the bill itself. Now, nurse administrators and supervisors should not be included in the calculation of the direct care registered nurse to patient ratio unless that nurse has a current and active direct patient care assignment and provides direct patient care in compliance with the requirements of the bill. That includes competency requirements. Now, patients would only be cared in units where direct care nurse to patient ratios meet the requirements of each patient. The hospital could not use video monitoring or any technology to replace the assigned nurse's professional judgment for the nursing process. The bill also asks for the right for a nurse, patient, or individual to submit a complaint with the secretary against the hospital that violates the provisions of the bill, and it asks for protection of reporting, and it asks to include a toll-free number that could be called. So to summarize, this bill would require hospitals to implement safe staffing plans without loopholes or repercussions to whistleblowers on unsafe practices. It would benefit the community by implementing safe and quality care with the health of both the patients and nurses in mind. Dear legislator, we urge you to support H.R. 2581, Nurse Staffing Standards for Hospital Patient Safety and Quality Care Act of 2019. As nurses, our duty is to keep our patients safe and give quality care, while taking care of ourselves too. It has become an issue within the hospital with the amount of patients we are assigned each shift. It is unsafe for patients, and many nurses have become burnt out and cannot fulfill their own self-care. You may ask yourself, why is this an important bill to support? The government has an interest in supporting public good and improving healthcare services to its citizens. In its current state, the healthcare system in this country is hurting nurses and placing patients at risk because there's not enough regulation done. The problems of placing a large number of patients to a single nurse has resulted in patient deaths, increased healthcare costs, and shortage of nurses. This bill states that hospitals must comply with staffing ratios set by the bill, which depends on the acuity of each unit. It also states that electronic monitoring cannot substitute for this, which ensures that each patient is receiving quality nursing care. The bill also provides an outlet for nurses and patients to report when this bill is violated. The bill does not exclude times of disaster due to the increased demand on nursing during these times. The goal of H.R. 2581, Nurse Staffing Standards for Hospital Patient Safety and Quality Care Act of 2019, is to ensure that hospitals implement a proper staffing plan by assigning staffing ratio requirements. This in turn will reduce workplace stress of nurses. In a 2010 Health Services Research study, it concluded that implementation of minimum nurse-to-patient staffing ratios in California led to improved patient outcomes and nurse retention. Thank you for your time, and we hope to hear your support for Bill H.R. 2581, Nurse Staffing Standards for Hospital Patient Safety and Quality Care Act of 2019.